Mummy! If you're looking for a fast-working but natural treatment to help a baby with colic or colic-like symptoms, then you are definitely in the right place.
Yes, in this video we are going to share with you the exact baby colic massage treatment that has helped so many babies with colic. And then we're also going to tell you what else you can do to really make sure that your little one is getting better as quickly as possible.
I am Natalie, a pregnancy and birth consultant and TCM therapist.
And I'm Matthias, a researcher and science geek, and we love helping mummies and their babies naturally and science-based.
For more useful tips and tools on pregnancy and baby-related topics, subscribe to our channel and hit the bell so you don't miss any of our videos.
Alright, so let us first start by telling you when you can apply this baby massage treatment. Well, as you already know, we call it baby colic massage treatment, but that doesn't mean that you can only apply it if your baby has officially been diagnosed with colic. The problem is that there are many different kinds of definitions of baby colic out there, and so very often the mothers who seek Natalie's treatment at the clinic tell her, well, my doctor at the hospital told me that my baby suffers from colic, but my pediatrician told me otherwise. So what should I do?
Well, if that's you, let us first give you some peace of mind. You can apply the baby colic massage treatment that we are about to show you, no matter if your baby really suffers from colic according to some healthcare provider, or if your baby only just suffers from colic-like symptoms.
Right.
In other words, you can apply it when your baby is fussing or crying all the time without obvious cause, given that there are no medical reasons why your baby develops such symptoms. For example, an underlying disease.
The other thing is our baby colic massage treatment works best if your baby's colic or colic-like symptoms are caused by gastrointestinal issues. So if you observe that your baby suffers from digestive issues, like for example bloating, a hard tummy, trapped gas, stomach ache and the likes, that's a good sign. Well, it's not a good sign, but what I mean is that our baby colic massage treatment is more likely to work, right?
Exactly. And one last thing before we teach you how to apply our baby colic massage treatment. The reason why this treatment is so effective is because it is a combination of classic baby massage techniques and acupressure.
Right.
So just in case you're not familiar with acupressure, acupressure involves the stimulation of so-called acupressure points, which can be found all over your baby's body. And this will indirectly stimulate the organs which are linked to these acupressure points.
Yes, our goal here is to balance the organs which are related to your baby's digestion so that they can maintain their normal function more easily. Well, actually there's more to it because at that age your baby's digestive system is only just developing, right?
Yeah.
However, we really don't want to bore you too much with the details here.
That's right. With that said, let's teach you how to apply our baby colic massage treatment. We start this baby massage treatment by stroking around her belly button in a clockwise direction. The purpose of this step is to stimulate the baby's colon. That is why it is so important that you do this in a clockwise direction, because this is how the digestive waste is moving in the colon. Do this for about 10 seconds. And by the way, you can apply firm pressure. Just don't overdo it. Simply use your parental intuition. Next, we are going to stimulate an acupressure point. That point is linked to the large intestine. It is commonly used to help a baby with pain and to help move digestive waste. So first, either take your baby's left or right hand. Find the fold between your baby's thumb and index finger. The point you're looking for is located on the fleshy webbing slightly above the end of the fold. Gently press and massage the point with either your thumb or index finger for about 10 seconds. Once you're done with one side, do exactly the same on the other side. In this next step, we simply bend the baby's knees and gently push her little legs towards her abdomen. That way we help the baby's body release gas, or trapped wind as we say in London. Repeat this movement at least 5 times. Gently grab your baby's ankles. Then push one leg towards his abdomen while bending his knee. Then straighten the leg while you repeat the exact same movement with his other leg. Repeat this bicycle movement a few times in a slow and relaxed way. Next, we are going to stimulate another acupressure point. It is commonly used to help calm a baby because it is linked to the liver, which is responsible for our emotions. First, find the tendons between the baby's big and second toe of either the left or right foot. As you move along the area between the two tendons, you will feel a fleshy webbing. It is located slightly above the end of the fold between the two toes. The acupressure point is located in that fleshy webbing. Gently press and massage the fleshy webbing with either your thumb or index finger for about 10 seconds. Once you're done with one side, do exactly the same on the other side. Finally, we are going to massage the baby's lower back. Place the heel of your hand on the dimple slightly above the center of your baby's buttocks. Then apply circular movements by moving the heel of your hand in a clockwise direction while applying gentle pressure. Repeat the circular movement 5 times. Okay, that was easy, right? Please keep in mind that you may have to repeat this treatment several times in order for it to be effective. In fact, we recommend that you include it into a bedtime routine. And if your baby suffers from a severe form of colic, it could help if you do not only apply it in the evening, but also in the morning or throughout the day.
Right.
With that said, what can you do if the treatment from this video has not helped your baby, let's say after 1 week?
But before we give you the answer, can we quickly ask you a question? How are you liking this video so far? We know our accent is terrible, however, maybe there are even more things that we need to improve. If so, we would be super grateful if you could leave us a short comment in the comment section below, or simply subscribe to our channel and or like this video so that we know that you found it helpful. We appreciate each and every one of your reactions because your feedback helps us a lot to improve our videos. Thanks so much. Okay, so what can you do if the treatment from this video has not helped your baby after, say, 1 week?
Well, there are several things that you can do. First of all, if you're breastfeeding, it could be that your baby's colic-like symptoms are caused by some food that you're eating. In fact, this topic is so important that we have already written a blog post about it, which you can find in the description below this video. So go check it out if you like.
Yeah.
We also plan to record a video, and if it is already online by the time when you watch this video, you should now see a pop-up at the top of your video screen.
About here. The other thing is, babies who develop colic or colic-like symptoms need a calm environment.
Yeah.
For example, it is not a good idea to breastfeed a colicky baby while watching TV or listening to loud music. Such things can considerably aggravate your baby's symptoms. Moreover, anything that can help calm a baby can improve a colicky baby's symptoms. Think of aromatic oils or herbs that have a calming effect. Think of relaxing teas. Think of relaxing colors for your baby's room.
Yeah.
There are a lot of things that can have a calming effect on a colicky baby, and we are definitely going to record a video on this topic too.
Absolutely. Now, all these calming tools become particularly important if your baby's colic symptoms are not caused by gastrointestinal issues, but by emotional issues. In fact, if the treatment from this video does not help your baby, chances are that your baby does not develop these symptoms due to gastrointestinal, but due to emotional issues.
Yes, and when we say emotional issues, we don't mean things like a depression and whatnot. What we actually mean is this. Don't forget that your baby was only just born. I mean, just imagine you hanging around, having a great time in your mother's womb, and then all of a sudden people knock on your door and tell you, hey, landlord wants her space back. Get the hell out of here. It sounds so trivial, but from a psychological point of view, the birth is a shock for your baby. Just think about all the new impressions that suddenly rained on that little baby, right? Particularly during the first 3 months of your baby's life. And that's exactly when most babies develop colic.
Exactly. Unfortunately, there is no way to find out if your baby's colic is based on emotional rather than gastrointestinal issues. Because from a psychological point of view, if a baby is overwhelmed by baby's emotions from digesting all the new impressions, baby may still suffer from digestive issues like a firm tummy, stomach ache, bloating, etc. And that makes it really hard to tell the difference.
Right. And as Natalie already mentioned, we only get a hint that it could be the emotional side that is plaguing your baby if the treatment from this video does not seem to have any effect. And this is when the calming tools and the calming environment become really important if you want to help your baby with colic.
Exactly. And then finally, there is one more thing that you can do to help your baby with colic. It's a pediatric baby massage treatment called Shonishin. This is what I do at the clinic. However, you can also apply it yourself at home if you like. Shonishin is a combination of tapping techniques, classic baby massage techniques, and stroking techniques. And the advantage of it is that we can not only address gastrointestinal, but also emotional issues.
Yeah. If that's something you want to try, you have two options. Either go find a Shonishin practitioner in your area, but please keep in mind that your baby will need to have regular treatments, ideally at least 3 to 4 times per week.
Yeah.
Alternatively, you can learn Shonishin online and apply it yourself if you like. The advantage is it is obviously going to be much cheaper than seeing a practitioner, and you can apply it more often, even daily if you like, which means that it will also have a much more powerful effect, right? Don't worry, it's neither difficult to learn nor difficult to apply. Anyone can do it. You can find more information about Shonishin and how to learn it in the description below this video.
Yeah. Thanks for watching. We really hope that we could help you help your baby. And if you don't mind, please leave us a feedback in the comment section below, or simply like and share our video if you have found it helpful. We really appreciate each and every one of your reactions, because your feedback helps us a lot to improve our videos.
Yeah, and for more useful tips and tools on pregnancy and baby related topics, make sure to subscribe to our channel and to hit the bell.